All right. Good morning, everyone. Welcome to TeleShadowing. We're live streaming this session to YouTube. I'm honored to introduce our mentor for today, Dr. Cheema. Dr. Cheema is an accomplished internist. She completed her internal medicine residency from the University of South Florida. She is a mentor to students and a published author in neuroendocrine tumors and infectious diseases. Dr. Cheema participates in community services and believes in health for all. She's also running a clinic for low-resource patients for free. Now I'd like to request Dr. Cheema to start today's session. Thank you.
Good morning, everyone. Thank you, Minahil. I think I was muted, so let's start again. Good morning, everyone. Thank you, Minahil, for the introduction. So as we know, it's weekend, so let's start with the why. It's Saturday morning here in the States. Some part of the world, it's afternoon. Some other parts of the world, it's evening time. At this time, we can be with our family, with our friends, with our loved ones, but we are here together, right? Why? I would like this session to be more interactive and need participation for better understanding. If I ask you any question and if you don't know the answer, that's fine. Try your best and give your best educational guess as we are here to learn. So let's start with why. You can type in the chat box if you like, and let's see if we get any responses. All right. All right, yes, I got a message that I was muted. Thank you for letting me know. All right. All right. So can someone type in the chat box why we are here this morning? All right. So someone type in here to learn and move forward our goals. Okay, good. We are here to learn more about how to help people in the medical science. Good. To learn more about the field of medicine, to explore medical fields. All right. Very good. There are a lot of responses. Awesome. I really appreciate it. Great. So last we got, I would like to learn more about helping others and my career path options. Great. Awesome. So definitely, yes, you all are right. We are here this weekend morning. It shows our passion, our commitment, our dedication for learning to help ourselves and help others, serve others through healthcare, right? So as we all know that healthcare is a very demanding profession, though it's very rewarding to help others, add value in others' lives, and help to relieve their sufferings at your level best. So we all need to know our why. Always start with why we need it. It keeps us motivated and keep us focused on our goals. So I would like to share my why as well. So for me, it's truly cherishing to play a vital role in the patient care side and influence medicine in other ways as well, being impactful, talking about the cases together with you guys and engaging with the community, students and residents for a bigger impact. And if even one student can learn 1 point, it can change his or her life, my goal will be fulfilled, right? So it's a beautiful circle of teaching the future healthcare professionals and taking care of the patients. And one-on-one interaction is so influential and impactful in serving the humanity. I feel so blessed having scientific knowledge, and it's our responsibility to share with others as well. Do our share to add value to others' life. And one small gesture can make a big difference in someone's life. So as Rumi said, I always try to quote his quotation, from our Lord we receive and to humanity we give. So always start with the question, why I'm doing it? why we do what we do. So we all have 5 senses, right? We can see, we can hear, we can feel, we can smell, we can taste. So why we all don't have equal knowledge? Why we have different levels of knowledge? But someone knowledge give big results, have bigger impacts. Like I can give example like Socrates, like Newton. So what Newton did, he saw the apple, who sees apple falling and make the law of gravity. And apples were falling since long, but no one paid much attention, and no one else find the cause behind the effect of apple falling. So this is the knowledge, the information, the understanding, the awareness is different. Why? So we all have 5 gates. And excuse me, I'm on call as well, and I'm getting one call. Let me take one call, please. All right, thank you everyone for your patience. I'm on call, so I got a call regarding one of my patient needs some prescriptions. Patient is going home and I need to write some prescriptions. All right, so my medical system will take care. All right, so let's move on. So as mentioned, we need to know that we all have 5 senses. Why have some people have bigger impact, give bigger results, and why different level of knowledge. So we all have 5 gates for input. Why we give different results? Why our output is different? Can someone share your thoughts? Let's see. What do you think? Let's see if we can get some responses. Okay. Okay, some people have different opportunities. Okay, good. Like education, okay, wealth, resources. Okay, good. You're right. So I would say answer is, for me, everyone can have their own explanation for that. Our thirst for knowledge, excuse me, our passion, our burning desire, how much we are focused, our area of interest, our concentration, our connection. Are we really truly want what we want, or we are just forced by someone else, do this, do that? So if we are passionate, so it will be easy for us to keep us on track to achieve our goals, and we go after excellence to learn more. So that's my understanding, the why some people give bigger results, have more impact than other people. But I can tell you, God has gifted all the same blessings in the sense of our body capacity and all this, but we all have some talents in one area or the other area. So if we know our strengths, our weaknesses, we can work on it, and we can have bigger results as well. So based on the thirst of knowledge, every people have different level of knowledge. And Socrates had answer to all the possible questions. And one time there's one student asked him, how did you get this knowledge? And Socrates said, come to the river tomorrow. That student went to the river. Socrates asked him, come inside the river. So what Socrates did, he put that student head under the water till he started gasping for air. He was unable to breathe under the water. So Socrates asked that student, what was your desire when you were under the water? So that student's only desire at that time was to breathe, right? So this is how much we need to be passionate about learning in any field of our life to achieve our goals. So it's up to you. Find your why you do what you do, and learn the knowledge that's beneficial for you and for humanity, for broader impact, and play your role and do your share at your level best. All right, so as it shows that you all guys are passionate, you all are committed, you're all dedicated to learn, explore your areas of interest so you can learn more, achieve your goals, and help yourself and serve others. All right, so I will move on from the question why. All right, so next slide. So it's absolutely an honor to be with you this morning. And a little bit talk about myself. I completed my internal medicine residency from University of South Florida. After completing my residency, I moved to Maryland along with my family. And now I'm practicing internal medicine, both inpatient and outpatient, and affiliated with University of Maryland Medical System. So before moving on to our today's simulated case, every time I talk, most of us who have listened to my prior lectures, my prior sessions, I talk about self-care first. Why? We all know that, right? Because if we are able to help care ourselves, then we will be able to help others, right? Okay, so I would like to ask a few questions. Are we happy about ourselves, about our health? Do we have a good appetite? Do we enjoy comfortable sleep? Do we perform workout daily basis? How we manage our emotions, our anger? Do we get upset if our opinion is rejected? What do other people think about us? Are we growing? Are we sure about the purpose of life? So these are all the questions. It's called self-audit and do self-analysis to help you where we stand and how we can improve ourselves. All right, so my purpose of life, I explored to help others at my level best. But how can I do that? I have to help myself first, right? So self has 4 domains of well-being that I will talk about briefly. So next, understanding ourselves. So sense of well-being, as I mentioned, all these questions ask yourself, and why I'm alive today. Find in your mind how I can make a difference. Next slide, please. All right, so what is self? So self has physical well-being, emotional well-being, intellectual well-being, and spiritual well-being. So let's talk about physical health first. Physical activity. Make a habit of regular exercise, consistent, moderate exercise on a daily basis is vital to keep our immune system healthy. And we can do exercises like going for a walk, bike riding, yoga, standing rather than sitting, taking the stairs up and down, stretching. So anything that keeps you moving. Any movement is better than no movement. And then nutritious diet. Because what we eat makes a big difference. It boosts our immune system. So please try to add nutritious food in your diet, consume a wide range of fiber, antioxidant-rich foods. At every meal, choose a rainbow of fruits, vegetables, whole grains, nuts, seeds, and also stay well hydrated as well. So please make a habit of healthy diet plan as well. And next, we have a quality sleep. Make sure we have a regular bedtime, wake up time. It's very important. And aim for sleep hours should be between 7 to 9 hours is optimal. Develop a habit, set up an alarm, and avoid screen time before go to bed. And practice your rituals. So you can write down your goals for the next day, read a good book, writing a journal, set up your goals for next day. And last but not least, mind your stress, listen to your body, be compassionate with your body as well. Be mindful and adapt some coping mechanism that can help you to manage the stress. We all have stress in our life. Don't think that someone have more resources, more knowledge, they don't have stress. No, everyone has it, but we all learn how to cope with it. That's why they become more successful. So it's very important, learn coping mechanism, learn how to manage, know your body very well. All right, so we need to remind ourselves, take care of ourselves as well, as healthy body has healthy mind. And we are the creatures of our habits. And there's a very good book I will recommend, The Biology of Belief by Bruce Lipton. He mentioned about the habit brain. So what we do, what we accomplish based on our habits. So if we want to achieve higher achievers, or do something good for community, for yourself, change the habits. And it can help us in our self-growth. All right, so emotional health. Emotional intelligence was first introduced by Daniel Goleman in 1995, and he wrote a book on it as well, Emotional Intelligence, and it plays a vital role in our growth curve. And it is as important as IQ. And one study mentions that we have 27 emotions and we need to manage to keep ourselves healthy. And there are 7 universal emotions, includes happiness, anger, sadness, fear, surprise, disgust, and contempt. And we have a very small portion, almond-shaped area in our brain called amygdala that manages our emotions, that plays a vital roles in our emotional management. And EQ, emotional intelligence, also called EQ, EQ is very important to learn how to respond appropriately and to not react aggressively in the stressful situations. And emotions are very contagious. Emotion is a state of mind associated with our thoughts, with our feelings, and our behavioral responses. So emotional intelligence has 4 skills I would like to go over again pretty quick. First of all, self-awareness, self-actualization of knowing ourselves. This means we must be aware of our emotions, our motives, recognize ourselves, know our strengths and weaknesses, know our confidence level. So do accurate self-assessment. I call it self-audit, to look into our weak areas and work on it to improve ourselves. And next level is self-management. When we know the areas that need improvement, it's also called self-regulation. So it means self-discipline. So we can learn, we can change our habits, but we have to be persistent in the face of frustrations, challenges, and recognize our emotions and address them and learn the adaptability. And we need to also learn how to channelize our emotions. And most importantly, the most powerful emotion is anger. It's very strong emotion, is full of energy, and we need to learn how to manage. It's called anger management. We are humans. We have we are sinusoidal ups and downs in our life. So how we can manage our emotions. And then social awareness. This means understanding about others as well, having empathy, having genuine empathy for others, meaning we have the ability to understand and share others' feelings as well. This also includes service orientation, community services, help others, add values in others' lives. So please keep an eye on social awareness as well. Last but not least, relationship management. What does it mean? Handling the relations appropriately, our ability to manage relations. Like in our situation, doctor-patient relationship, right? We have to build up good rapport. And most important skill for management of relationship is communication skill. Be assertive, learn conflict management. At every level, we face the conflicts. So we have to polish our skills to manage the conflicts and learn how to resolve the conflicts and collaborate with others and work together as a team. It's very important. Teamwork is a dream work, because if you want to achieve something, you have to have a good team to move on for your self-growth in all areas of your life. All right, next is intellectual health. It's one of the most important elements of intelligence. And this means how we process the information, how we take the information, and how we take the information, process it, synthesize it, and how we apply it and begin to respond to that information intelligently, and how we can improve it. It's very easy. I know it's time consuming. Train the brain. How we can do that, right? By practicing the skills, by reading books, by using visualization skills, learning from our mentors. Add mentors in your life. Mentors make your life easy because they have gone through that path. So try to add more mentors in your life. I still have mentors in my life. I learn where I feel I have a weakness in that area. I need to improve myself. Enroll online courses that can help you. Read quality articles. So whenever we learn something new, our cognitive ability curve goes up. And last but not least, spiritual health. What's that? It's this capacity of human beings to know the purpose of life by self-understanding, right? By having a high degree of compassion of human values, our ethics, our values. It's basically acknowledging our morality, our thinking process. So what we can offer to the humanity. So it's living in a humility, bearing in mind that we are just a tiny component of the universe. Be humble, live simple, be beneficial for others, fulfill our social responsibility, and last but not least, attitude of gratitude. It's very important. Count your blessings every day. We all are blessed this morning. Every time I say adapt the attitude of gratitude, why? We all woke up this morning, right? We are breathing. And there are many other blessings we can count. We can see, many people cannot see. We can hear, many people cannot hear. And there are many people who cannot have striving for food and shelter. And they are striving for those things that we already have. So please count your blessings every day. And your spiritual well-being, find your why that we started with. Find your why and start with why. All right, so let's move on and start our simulated case. This is a disclosure that information is for educational purposes only for students. Please do not use this information for treatment or any medical conditions. This is not a substitute for medical advice. So you should not disregard your physician's professional medical advice or delay seeking care because of something you have learned in this simulated patient case study we will do right now. And reminder, remember to call your doctor or 911 for any emergency situation. All right, so let's start, take a ride of simulated case. So I would like to share first, a good physician should not deal with the disease only, rather patient as a person, as an individual. All right, so let's see, we have one patient in our waiting room, Miss Jones. She's 28 years old, female, and let's start our conversation. All right. Good morning, Ms. Jones. My name is Dr. Cheema. It's nice to meet you.
Hi, Dr. Cheema.
Ms. Jones, first of all, thank you for your patience and understanding. As you know, we are really busy during this pandemic.
Yes, doctor, I understand.
Thank you. How can I help you today, Ms. Jones?
I've had a cough, sore throat, and sinus congestion, sinus pressure, and I'm hoping that I can get antibiotics to get better.
Okay. All right. I need to ask a few more details about it. Is it okay with you?
Sure.
Okay. For how long you have these symptoms?
I think it started about 4 days ago.
Okay. So for last 4 days, you mentioned you have cough, you have sore throat and sinus congestion. Is that right?
Yes.
Okay. All right. So for last 4 days, your symptoms are getting better, getting worse, or still the same?
They're getting worse.
Okay. All right. Do you have any fever or chills?
No.
Okay. Any body aches or weakness?
A little bit. I can get tired easily.
Okay. All right. And do you have any nausea or vomiting?
No.
Any loose stool?
No.
Okay. Do you have any shortness of breath?
Well, I have asthma and I'm using inhalers for my shortness of breath.
Okay. All right. For how long you're using your inhaler?
It's been about 4 years now.
Okay. And how often you use your inhalers?
I used them once a day as needed.
Okay. All right. Since you are sick, as you mentioned, for last 4 days, so you are still using once a day or you need it more often?
No, I still use them once a day.
Okay. All right. Good. Any chest pain or chest tightness?
No.
Any runny nose?
No.
Any sneezing?
No.
Any loss of taste or smell?
No.
Okay. Do you have any recent travel?
No.
Okay. All right. As we know, we are facing pandemic. Do you think you have any COVID-19 exposure?
I'm not sure because I was at a friend's get-together probably over a week ago, but I'm not sure about the exposure.
Okay. All right. Are you taking any medications to help you to relieve your symptoms?
Yes, I'm using over-the-counter medications with minimal relief.
Okay. All right. And are you bringing up any phlegm with the cough?
Yes, it's sometimes clear and sometimes yellowish in color.
Okay. All right. And do you smoke?
No.
Okay. All right. Anyone sick around you in family or friend circle?
A few of my friends are sick who I met.
Okay. All right. All right. Have you ever had this before or this is the first time?
Yeah, it happened a long time ago with the same symptoms and it got better after taking antibiotics.
Okay. All right. So we'll stop here and let's see what's the differential diagnosis. So I would like the participation for everyone. Differential diagnosis means whatever patient told us based on the symptoms, what do you think what's going on with the patient? So we'll make the list of the diagnosis. Everyone can type in the chat box and let's see what you guys think what's going on with the patient. Okay, let's see. We are waiting for responses, critical thinking skills. Okay, it might be COVID-19. Okay, sinus infection. All right, good. So you know there's something going on with the respiratory system. Flu. Okay, good. Yeah, so you can think of any respiratory causes that can cause this. Throat infection. Okay, good. All right, yes, so we are getting good responses. Okay, all right. Allergies. Okay, good. COVID maybe or flu. All right. Strep throat. Good. Yes. So someone is thinking of other than viral infections. Viral infections, okay, strep throat, okay, good. All right, good. So let's see. So I'm going to move on with the differentials. So we have, first of all, I would like to go over, so differential diagnosis, you guys are right. It can be COVID-19 infection, it can be flu, influenza A, influenza B, epiglottitis, tonsillitis, laryngitis, pharyngitis, sinusitis. It can be lower respiratory, bronchitis, and pneumonia. So first of all, before going on the detail, let's see go over pretty quick the respiratory system, anatomy, and physiology pretty quick. So why we call upper respiratory tract and the lower respiratory. So this one, nasal cavity, this is the pharynx area, larynx, this we call voice box as well. And the lower respiratory, trachea, bronchi, and lungs. So these are all the area we divide upper respiratory infection and lower respiratory infections. So trachea is basically commonly known as the windpipe, and it's about 4 inches long, and it's about less than an inch in diameter in most people. And the trachea begins just under the larynx, the voice box, and runs down behind the sternum. Sternum is our central chest bone, breastbone. And trachea then divides into 2 smaller tubes called bronchi, and 1 bronchus for each lung, right bronchus or left bronchus. And then bronchi, the 2 large tubes that carry air from the windpipe to your lungs. And the main airways are called the bronchi. And they branch off into smaller and smaller passageways and turn into bronchioles that lead into tiny air space called the alveoli. I will show you over here, you can see over here, nasal cavity, oropharynx, larynx, trachea. So then right bronchus, left bronchus. And then bronchi drive into bronchioles. And then they end up in the alveoli, small air sac at the end of the bronchioles. And alveoli are the tiny balloon-shaped structures, and they are a smaller structure in the respiratory system, and they are arranged in clusters and take part in the gas exchange. And during gas exchange, I will show you one picture over here, that oxygen moves from the lungs into the bloodstream, like oxygen, right? We are inhaling oxygen. This is the alveoli. This is the alveolus. This is the blood capillary. So oxygen is moving into the blood vessel, and blood vessel bring out CO2, carbon dioxide, passes from the blood to the lungs. This is how when we exhale, we take the CO2 out and we inhale oxygen. So this oxygen reaches the alveolus level, alveoli, and then exchange takes place over here at this level. So this happens in the lungs between the alveoli and the network of the tiny blood vessels called the capillaries. Capillaries are the small blood vessels which are located in the walls of the alveoli. And this process is called, how it happens, by the process of diffusion. That's why you learn about physics and biochemistry, you learn about this process diffusion. So oxygen moves from the alveoli into the blood to the capillaries lining the alveolar walls. And respiration is the terminology we use for the gas exchange. And I will go back to the anatomy of the lungs. The lungs are basically the foundational organs of the respiratory system. And the basic function is to facilitate the gas exchange at the level of the alveoli, at the capillary membranes, from the environment into the bloodstream. Excuse me. So oxygen gets transported through the alveoli into the capillaries, where it can enter in the arterial system and ultimately perfuse all the tissues of the body. And the respiratory system is composed primarily, as we talk about, all the upper respiratory part, second and lower respiratory, and lungs is further divided into individual lobes. And then they divide into over a million of alveoli. And alveoli are primary location of the gas exchange, basically. So you can see over here, the right lung has a superior lobe, middle lobe, and the inferior lobe. So there are fissures in between. And on the left side, there are 2 lobes, superior lobe and the inferior lobe. And these are all, you can see trachea, left bronchus, right bronchus, then bronchioles, and then at the end, alveoli. So there are millions of about 300 million alveoli, and the alveoli are primary location for the gas exchange. And the respiratory muscles that help for they receive the innervation. They receive the nerve innervation is from the nerve roots C3, C4, and C5. Nerve is called phrenic nerve because it's a diaphragm muscle at the bottom of the both lungs. There's a muscle called diaphragm, supplied by the C3, C4, C5 nerve root or phrenic nerve that supply this muscle to help. And there's external intercostal muscle between the rib cage. There are the muscles called inspiratory muscles, and they are used primarily during exercise and respiratory distress. They help opening up lungs. And the significant, the physiology of there's the lung volumes. I will just talk briefly about it. What is the tidal volume? So tidal volume, you can see over here, there's this sinusoidal up and down. This is called tidal volume. It's basically a volume we inhale and exhale with each breath. And then there's an inspiratory reserve volume. What is that? The volume that can be breathed in after normal inspiration, like we are breathing normally, right? So with the force in the volume that is, we can more breathe in after normal inspiration is called inspiratory reserve volume. And then there's expiratory reserve volume, the volume that we can expired, that we can exhaled after normal breathing pattern. And then there's a residual volume, you can see at the bottom. So this is the volume remaining in the lung after maximal expiration. And we measure all these volumes via lung, by spirometry, and the reserve volume we cannot be measured by the spirometry. All right, so we talk about the upper respiratory infections and the lower respiratory infections, as we mentioned, and also there's a lining around the lungs called pleura. It's called visceral pleura and parietal pleura. You can see in this diagram, the lining of around the lungs. All right, so let's talk about the respiratory infections. So upper respiratory infections, as we mentioned in our similarity case, presented with the symptoms of a cough. So common symptom, the most common symptom is a cough. And of course, all these differential we discussed, tonsillitis, laryngitis, pharyngitis, sinusitis can cause this. And also the lower respiratory lung infection can cause this as well. And what are the causes? It can be bacterial and viral, as someone mentioned in the chat box as well. That's really good. So causes can be bacterial and viral. And respiratory infections can be caused by the viruses, bacteria, or fungi. All right, so how can we prevent it? So we all are hearing about vaccine, right? So it can be prevented by immunizations, adequate nutrition, and by addressing the environmental factors. And it can be caused by the bacteria that can be treated with antibiotics, as our simulated patient was asking about the antibiotics, right? We'll talk more about our case. All right, so transmission, most of us know, because this pandemic can be spread in a number of ways, and most commonly through the air. It can be infecting our lungs as well as we inhale. So they can be spread by airborne droplets from cough or sneezing. And presenting symptoms, as our similarity case mentioned, cough, sore throat. These are symptoms, some sinus congestion, and risk factors that patients can have more frequent sinus infections or respiratory infections when they have a weak immune system, when they're undernourished, when they're malnourished. And pre-existing illnesses can cause it. Like in our similarity case, patient has asthma, and some environmental factors prone towards a susceptibility towards respiratory infections like smoking and the pollution, environmental. All right, and the treatment varies, but we need to focus more on the prevention. And how do we check, how do we know in our patient, our similarity case mentioned the symptoms? So what can we do now? Patient is asking for the antibiotics. So what do you think? What should be the next step? Let's see if you guys can participate. Someone knows what can we do next? Screening. Okay, good. How we can do that? Venkat mentioned in screening. Good. Yes, you're right. How do we do the screening? Any other response? Okay. So yes, we do the check viral test. Okay, swabs. Good. X-ray the lungs. Okay. All right. So these are all good options. Okay. So now we check. Someone mentioned swabs. Yes, we do the nasopharyngeal swab. And what can we do? Like patient comes in, so how do we know that? Patient asking for the antibiotics. So of course, we have to educate the patient. We have to make sure we are treating the right way. So how do we check the respiratory panel? So this you can see over here, we are showing you all the panel we check. But normally we're checking COVID-19 infection, we're checking for the flu, and we're checking for the strep throat for one swab. And how we collect the sample? The sample is collected from the back of your nose and throat. It's called nasopharyngeal swab. And this is done by inserting the swab gently through a nostril until resistance is met. It's about 1 to 2 inches, and then rotated several times and withdrawn. And this may tickle a little bit and can cause teary eyes as well. So this is how we check different, but if we just want to check all the respiratory panels, so these are different viruses we can check. Respiratory syncytial virus called RSV, parainfluenza, influenza A, B, so coronavirus, different strains. And then the strep, someone mentioned about a strep throat, right? So streptococcus we can check as well. So this is how we can rule out. So let's wrap our case first, in a simulated case. So we collected the sample and the result came back and it was positive for flu and negative for COVID-19 infection and the strep pneumonia. That's good, right? So what can we do now? We have to treat. How we can treat? So I mentioned patient is positive for the flu, but negative for the COVID-19 infection and strep. So what is the treatment option? What should we do? Let's see if someone knows. What can we do? Antibiotics, okay. All right. You can take antibiotics, okay. Analgesic, okay. All right. So flu is a viral infection. In flu, other words, influenza A, influenza B. So we don't need to treat the antibiotic. Flu is a viral infection. COVID-19 is a viral infection. So this is how we have to make sure viral infection, bacterial infection. So we don't treat viral infections with the antibiotics. So our simulated case result came back with the flu. It's a viral infection and patient is requesting for antibiotics, right? So what should we do? Should we give antibiotics? No. So we have to educate the patient, right? So patient education is very important, that there is no indication of antibiotics in viral infection. And sometimes what happens with a viral infection, there is super bacterial infection. In that scenario, yes, we can give the antibiotic, but in this scenario, in our simulated case, patient has a viral infection and there is no indication for the antibiotic in this scenario. All right, so let's move on to next, prevention. So prevention is better than cure, right? We all hear prevention is better than cure. So we all have vaccines available now, COVID-19 vaccine. We have influenza vaccine, we should get once a year. And we have pneumococcal vaccine as well. So these are all the vaccines we can use. And of course, during this pandemic, now it has been approved for the age 5 and above. So everyone should get it. And of course, the one who has get more than 6 months, they can get booster dose as well. So how do vaccines work, basically? So in simple terminology, it's basically a weak or dead part of the germ, form of germ, that is introduced into the body that sparks our immune system and develop the antibodies that remembers the germ in its memory. So they have a memory system. And antibodies fight off that germ if that invades again. So that's a mechanism, and that's a simple way how vaccines work. So it's very important for prevention. So prevention is better than cure. So always try to go for vaccines. All right. So next we have, so I want to more talk about what is the medicine. Medicine is an art. What do you mean by that? The importance of the art of medicine is because we have to deal with the human beings, body and mind. So we are not just treating the illnesses. We are not treating the just diseases. We have to take the person as a whole, as a whole individual. So we are in the medicine profession and it's service driven. And how we apply the evidence-based medicine to every patient, we physicians evaluate, and we use evidence-based algorithm solely as guidelines, and each patient must be treated as on an individual basis. And the purposes of medicine, I would like to go over the goals of medicine. Basically, let's see, next slide. So the goals of medicine encompass the relief of pain and suffering, and the promotion of health and prevention of the disease. As we all know, prevention is better than cure. So we should always have go focus on the prevention side as well. And then cure of the disease, and then reducing the mortality. So during this pandemic, we have seen a lot of mortalities as well, unfortunately. And now prevention side is what? Vaccines. Now vaccines has been available and approved as well. So that's very important. Go towards it and get it done to help yourself and help others, to protect others as well. And there's a mastering of the art of medicine. So how we can do that? Focus on the patient. Take a moment to focus before entering the patient's room. Establish a connection, establish a rapport with the patient by developing rapport. Like if you are following me, if you're observing me in the real scenario in my office, in the hospital, so you will see how we see the patients in the live scenario, right? How we interact, how we develop the rapport with the patient. So these are all bedside manners are very important. And assess patient response to illnesses, know how much they know about it, because patients are the boss of the body and mind. They know their body well. So patient give you diagnosis. So listen to the patients. So communication is very important. Communication to foster the healing. And of course, I always tell my patient at the end, give me a smile. Laughter is the best medicine. So, and also always show genuine empathy as well. So as I mentioned about the evidence-based medicine, what is evidence-based medicine? So basically it is a judicious use of the current best evidence in making the decisions about the care of the individual patients. It varies from individual to individual. It's not just we have to fit one for everyone. So that's why it's very judicious use of current best evidence. And basically it is based on the clinical expertise, it's based on the best research evidence and patient values and preferences as well. So whenever we prescribe the medicine, so we have to think about it, because medicines have side effects as well, right? So we need to choose wisely. So we need to think about it. If we're going to give the medicine, it's going to change the symptoms of the patient. Yes or no, we have to ask ourselves before prescribing any medicine, have side effects as well. And is going to change any natural history of the disease, any uninterrupted progression of the disease from exposure to agents until recovery. So choosing wisely. And of course, will it help to change the mortality? So these are all before prescribing any medicine. As in our simulated patient, a patient requested that she has symptoms and she need antibiotics, right? So we have to educate the patient that antibiotic is for the bacterial infection, not for the viral infection. So like I'm seeing a lot of cases in urgent care, everyone comes in and they're requesting for the antibiotics. And most of the time it's a viral infection and there's no indication for that. All right, so these are the resources we use to get up-to-date information. So basically up-to-date is a clinical resource for medical knowledge, and the decision, it helps to make the decision, and it is trusted for about more than 2 million medical professionals worldwide, and all the up-to-date information is there. And I think more than 7,000 physician authors, editors, and reviewers use the rigorous editorial process to synthesize the most recent medical findings into the trusted evidence-based content, and recommendations are given, and that can be acted on at the point of care. And then I was talking about the prevention. So there's a US Preventive Services Task Force called USPSTF. It's an independent panel of experts in primary care and prevention that systematically reviews the evidence of effectiveness, and it develops the recommendations for clinical preventive services. And of course, choosing wisely, this is another source. It's a complete list of recommendations by society, and it can be found by clicking the society name or by individual recommendation pages, and there's a lot of information there as well. And most importantly, CDC guidelines. So CDC works 24/7 to protect the communities and promote health and safety for the communities, and we do follow CDC guidelines as well. And of course, medicine is a lifelong learning, and that's why you have to choose this field or any field. Ask yourself, start with yourself, start with your why you're doing it. It's a lifelong learning, but of course it's really rewarding. I will highly recommend you should join if you're really passionate about it. But of course there are challenges, and of course, as I mentioned, that start with why and find your why, and it will be for you to pursue in your field of interest despite any challenges. And I would like to share one video with you because I love my profession. I feel like I'm not working a single day because I love it, what I do every day. Because when you love your work, whatever you're doing, you're studying, you're reading books, you're watching movie, time flies, right? Because you don't think you're working. You enjoy what you do. So I believe in community services, and we arranged a free medical clinic last month in December last year in one of the underserved area. Let me turn this on again. I think, hold on a second. Yeah, okay. It's playing right now, but let me start again. So it's one of the underserved area in Pakistan. So normally when we go, we try to arrange free medical camps for underserved area. As we see about 175 patients. It was a very cold weather without any heating system. And it all happened because we want to pay back to the community. And I hope one day when you will achieve your goals, even for now, start helping others at your level best. Even small gesture can make a big impact in someone's life. That should be the goal, to help others at your level best, at our level best. All right. So let's move on. So next we have what is grit? Can someone tell me what is grit? Let's see if I get some responses in the chat box. Perseverance. Okay, good. So Venkat mentioned perseverance. Let's see, we get a few more responses. Resilience. Okay, good. Motivation, resilience. Yes, we are ambition. So we got a lot of responses. Nandini said motivation. Alexander mentioned resilience. Dhawan, yeah, ambition, resilience. Khadija mentioned resilience. Okay, good. So what does it mean to have grit? To have grit means you have courage, you have strength, you have so strong character. A person with a true grit has a passion and perseverance despite any challenges. And as I mentioned, we all have challenges in our life, we all have stress in our life, but main thing is how we cope with it, how we manage it. So that's why self-management is very important. Self-care is very important, because we spend most of our time with ourselves. And we set your goals. And when we set the goals and we follow through despite any challenges, and person who works really hard to follow through on commitments has true grit. So first, take some time, think about it, which field you want to go, which field you want to choose. Then ask yourself, can you do it? Are you really passionate about it? Will it help you? So if we are able to help ourselves, then we will be able to others, right? Otherwise, if we are not, from all aspects, from health standpoint, from knowledge, from emotional standpoint, from spiritual standpoint, our purpose of life. So when we know ourselves, our weakness and strength, then we can have a bigger impact and we can help ourselves as well. And next, I would like to talk about is success. Let's see, what do you mean success? What do you think? What is success for you? I would like a few responses and then we'll wrap up. I'm getting a few more calls and I have to address those. Okay, let's see. What is success for you? What is the definition of success for you? Everyone has their own achieve goals. Okay, good. Okay, so I need to ask, do you set any goals for you for 2022? One goal that you have decided that you have to achieve this year? Would you like to share one goal for that you have set for yourself? This is my goal for this year. Happiness after achieving goals. Okay, do a research. Okay, good. Let's see how many responses we receive. What are your goals for 2022? Read more non-fiction books. Okay, good. All right. Maintain a better sleep schedule. Keep up with schoolwork and other. Maintain a better sleep schedule. Clinical program this year. Okay, good. So these are all good, healthy goals you have. And most importantly, your self-care. Few people will be so frustrated and keep talking about self, right? All right. So yeah, of course, it should be in your goal as well. taking care with mental health. Good. Yeah, the mental health is very important. So because we think in our society, and I would say worldwide, this kind of stigma. We don't want to bring it up. And it's like sometimes when I see my patients, most of them need mental health instead of, because all the mental issues comes in a physical symptoms, and they don't have any uh, medical condition that need to be taken care. But of course, they think that but their mental health need to be addressed. That's very important. Most of the time, I spend most of my time in counseling and educating, and it's really our mental health need to be addressed. And during this pandemic, I have seen a lot of cases, a lot of patients that need real help. So, of course, as I mentioned before, we are the creature of our habits, and we need to adapt those habits that is beneficial for ourselves, right? For the humanity in general. And there's a good book I already mentioned with you. And of course, there's a 7 Habits of Highly Effective People. There's also a good book, 7 Habits of Highly Effective Teens. If you want to read that one, and that's really good. And it will help you in your self-growth, achieve your goals. And of course, when you will achieve your goal, you will feel good. Someone mentioned achieve goals and be happy. So that's a success, right, for someone. So everyone has their own definition of success. That's good. Okay, I will stop here. I'm getting a lot of calls. I will just make it short. I wish you all good luck for your career and beyond. And let's see if we have any questions pretty quick. But I have to address a few calls first. Let's see in the next slide, please. Q&A session. Yes. Okay. All right. So we are all done. All right. Any quick questions I can address? Let's see in the chat box. Someone asked a few questions. All right. Do you use same link? Thank you. Thank you. Okay. All right. All right. Thank you, everyone. I have a few important calls to return, and I have a few prescriptions to send for the patients, and keep up the good work. And I wish you all good luck. And I hope one day you will be telling me good stories. How did you make an impact, right? All right. Thank you, everyone.
Thank you very much, Dr. Cheema. We truly appreciate you taking the time to answer all of our questions and teaching us so much. And I'd love everyone to please give a warm thank you to Dr. Cheema in the chat box, as I see you have already done. So now we're going to conduct our closing session with our quiz and future session dates. So the link to the quiz for this session will be posted in about 10 minutes onto our website. So please give us a moment while we sort out our technical difficulties. And again, you'll need a 70% or higher to pass and receive certification. And that link is in the chat now. And many of our students have expressed interest in pursuing leadership opportunities with teleshadowing. And we've reopened our leadership application for students interested in joining our team as well. So that link is in the chat. And now on to our next session dates. These dates will also be posted throughout our social media outlets, so be sure to follow us at TeleShadowing. Our next session will be next Saturday on January 22nd at 10 a.m. Eastern Standard Time. Please note that the following week session will be on Friday, January 28th instead of a Saturday. And thank you so much to everyone for attending today's session, and we hope to see you in upcoming sessions as well. This concludes this week's shadowing session.